This video is about Renee Zellweger and the facial plastic surgeries that she may have had. In 1996, at the age of 27, you can see here, this is her natural appearance and she has great proportion of the horizontal thirds of the face. She has a really nice lateral brow position, great cheekbone structure. I think her nose complements her face beautifully. You can see the natural fullness of her lips. You can see the strong jawline and chin. And one thing to notice is that there's this lack of supratarsal crease, and that's the crease right of the upper eyelid, and that's relevant to what we'll see later on. So just something to notice. She has it just congenitally not present. So that is a natural look for her and something we'll discuss more later on. So we're at the end of this video going to add up the approximate cost of her surgeries and some of the non-surgical procedures, so stay tuned for that. And make sure to check out our hoodie merch. There's a link in the description below, so please take a look. Partial proceeds do go to charity. In 1997, at the age of 28, I'm not seeing any changes. It's interesting here, I'd like to point out that the lower tooth show here that I see in many of her photos give her this kind of very characteristic look, and there's this natural central deficit of her lower red lip that's accounting for this, and that's just something she was born with, which is something I see on some of my patients, but I think worth noting because it does give her a characteristic look. 1998, at the age of 29, there's great upper tooth show with the beautiful smile, and I generally don't comment on veneers. I'm not a professional in that, but who knows, maybe she had them here, maybe not, but we'll keep going. 1999, at the age of 30, I don't see any changes. 2000, age 31, no change. There are still signs of natural forehead horizontal lines or rhytids that are visible, which says to me that there hasn't been any Botox use or anything like that at this stage. 2001, age 32, I don't see any signs of change. 2002, age 33, there are some early signs of lateral brow ptosis where the lateral aspect of the eyebrow, the tail, starts to slowly descend down. That happens to all of us as we age. So I'm seeing some of those signs here at age 33, and I'm seeing some signs of maybe the early start of Botox and filler. This is around the time when it was starting to get more popular, around the time that it became FDA approved for use for cosmetic purposes. 2003, at the age of 34, Renee's face appears fuller. I'm not sure if this was possibly just weight gain. I think oftentimes we underestimate the impact that weight change can have on the face, both on making it look thinner or fuller, and it's not always the result of some sort of surgery or injectable. Sometimes it's just changes in weight and fluctuations. 2004, at the age of 35, I'm not seeing any signs of obvious change. 2005, age 36, what I'm seeing here is that Renee Zellweger seems to have had a brow lift. And notice how that lateral brow is now more lifted. When you compare the head of the brow to the tail of the brow, there's an upward slope that you see going from the head to the tail. And that is more of what she had when she was much younger, even though she's still just 36, but I'm seeing signs of a lateral brow lift, and there's just more infrabrow space. The space below the brow and above the eyelid, there's just more there, so I think she may have had a brow lift at this point, and possibly along with that a canthoplasty to reposition the eye into a bit more, again, of a youthful position as opposed to just horizontal, lifting that lateral canthus and creating a little bit of a cant there. 2006, at the age of 37, I'm not seeing any obvious change. 2007, at the age of 38, I think there's been continued use of neurotoxin. You can tell on the forehead, on the glabella, they look very smooth, and I think that's signs of continued neurotoxin use such as Botox. 2008, age 39, no major changes. 2009, age 40. So initially, when I looked at the photo on the left here, there was a lot more definition to the bridge of the nose, and it just looked more narrow, and I started to think, well, maybe she had a rhinoplasty, but as I kept looking on over time, I saw that the nose actually looked very similar to her original. So I think that in this specific image, either it's the use of makeup or potentially a Photoshop type of result here that makes the nose look a lot more narrow, but I do not think that Renee had a rhinoplasty at any point, actually. Please make sure to subscribe to our channel. 2010, age 41, no major changes seen from prior. prior, same in 2011. 2012, age 43, I see some signs of upper and possibly lower blepharoplasty. So that's upper and lower eyelid surgery. You can tell with the upper eyelid, and this goes back to what I said initially, where Renee doesn't naturally have a very obvious supratarsal crease, but now you're starting to see a supratarsal crease, and one way to do that would be to just do an upper blepharoplasty where you're removing a lot of skin and you can start to get a hollowing of that upper eyelid. You can start to see some upper supratarsal crease. Another way is to do a brow lift along with that. I think she's probably had a combination of the two, but in this specific sequence, I think it was an upper and lower blepharoplasty. Moving on to 2013 at age 44. So I think she may have had cheek implants at this point, plus minus fat transfer to the face. The face looks fuller in parts. The cheeks, even though she naturally has full cheeks, I think she was starting to lose some of that volume, and it looks restored, but in a very kind of specific type of way that may be the result of a cheek implant. Again, this is all speculative, but these are just some of my thoughts. 2014 at the age of 45, I don't see any further changes. Same in 2015 and 2016. In 2017, age 48, still no major changes compared to few years back. But in 2018, at age 49, I think that Renee Zellweger had a revision brow lift. The brows again look more lifted, and she may have had an additional revision upper blepharoplasty at this time. That would not be unusual to do that form of combination, and I see that sustained in the years to come. In 2019, at the age of 50, I think she may have had a facelift at around this time. One thing that I look for, aside from just the tightening of the jawline, is also the tragus position. So that's the position of this structure right in here in front of the ear. As you pull the skin back and go to remove the excess skin, if you remove too much, what happens is that the skin can recoil back, and as it recoils back, it can sometimes pull the tragus forward. And so what can happen is something called a shotgun deformity, where the ear canal is now more open because that tragus has been pushed forward. And I'm seeing some signs of that on her. Again, just speculative, but I think maybe she had a facelift around this time. 2020, age 51, no further change. 2021, so now this is last year at the age of 52, I think she may have had additional fat transfer to the face, maybe also some filler, maybe one, maybe the other, maybe a combination of the two. There's just, again, added fullness to the face that I think that may have contributed the fat transfer. 2022, age 53, with some of these recent photos, what I'm seeing is that she may have had a revision cheek implant. The cheeks, and this again is starting to make her look very different from what she looked like originally. I think the focus of the cheek volume is more medially based as opposed to how she had it more in youth, where it was more laterally based, and that to me signals a potential cheek implant revision. And again, if you look at the left ear on this photo on the right hand side, you can see that the tragus is just kind of pulled forward, and that to me suggests a potential facelift result from a few years prior. On the high end, the total of all these procedures is $315,000. Since you like this video, check out this other facial plastic surgery analysis that I did on Madonna.